Morning, Commissioners.
Good morning, John.
You've got a report there for April financials. We had been doing pretty well this year up until April. We had a low revenue month, both in the hospital and the clinics. The first page there I've got summarizes both month and year to date what the numbers are. Bottom line for the month, there was 142,000 in the red, which brings the year to date total to 162,000 in the red. Next page is the balance sheet. Couple of numbers on there, a couple of ratios I want to just briefly touch. Days cash on hand, 8.3. I want to touch on cash in just a moment from the short-term basis. Also, you've seen at the bottom there, I've got two accounts receivable net day numbers. One is 89 and one's 37. I put the 37 on there. That indicates the claims that have insurance and how fast those are turning around, because by and large, that's where most of the cash is in those claims. The next page breaks down all of our units, hospital, EMS, clinics, by month and year to date. Again, those numbers at the bottom there will tie back to the numbers on the front page. And looking at the question a while ago about the additional revenue for the ambulance, as you can see year to date there on that page, we're writing off about 50% of what we charge due to contractual adjustments, possibly bad debts and charity. I said I want to touch on cash just for a moment. This is a very short-term explanation. If you look on the balance sheet, under due from Medicare and Medicaid and others, there's a $408,000 figure up there. I'm looking at April, which is the far right-hand column on the balance sheet. We have turned in now to Medicare, to CMS, $800,000 of items that we had to spend to meet meaningful use for electronic medical records. Given our Medicare percentage, we turned that in the next to last Friday in April. The estimate is there anywhere from 45 to 60 days that money will be coming to us. And I'm saying about 50 to 55% of it, not the whole thing, because that depends on our Medicare percentage of payer mix. So that's one thing. Another thing on cash I'd like to update you for, this is not as definite yet, but Medicare, as you know, has approved, or CMS has approved the state's plan to implement the lip and dish payments next year. We were what they call a Tier 1 hospital, which means our numbers, as the plan was presented, would be going up from $393,000 in 2015 up to about a little bit over $1 million, about a $630,000 increase. But there's a caveat there. Like I say, Medicare has accepted Florida's methodology for doing this, but the total funding of all that depends on all the other hospitals in the state that participate in intergovernmental transfers. So that process is going to be ongoing until sometime in August. So at some point in August, we'll have a better idea for what our lip and dish payments are going to be. I'd love to sit here and tell you they're going to go up, you know, that percentage, but that'd be premature of me to do that. Again, another very short-term cash thing I want to speak of, and we've had both long and short-term issues to deal with our cash and with our claims processing and our IT systems. We've got today about $92,000 at Medicare that's been ready to pay. It's just a little glitch in the system that was unusual but was discovered. Indicates to me that the problems we've had with billing claims normally, they're getting worked through. We're not where we want to be yet, but that's a working process that's going well. Also, there's another $111,000 coming from Medicaid. That's going to be partially lip and dish. So in the very short term, we've got some good cash issues about to happen, but again, we'll update you when they do happen. And I know that's with the cash coming in. Of course, we've got the obligations of the healthcare trust fund and the regular vendors, so we'll deal with that as we need to. Are there any questions on the financials?
I have some questions, Mr. John.
Okay.
Last board meeting, you reported that you had 13 days cash on hand.
Right.
Right?
Mm-hmm.
And, in actuality, you only had 8?
No,
Because-
the balance sheet goes month to month.
Well, the reason why I'm asking you this, I praised you, if you don't remember, I praised you for that. And at the same time, the very afternoon or the next day, y'all had to come on in there and get some more off that trust fund money that we allowed you to get, right?
Yes,
So your cash on hand was not 13 days. If you had cash on hand, you wouldn't have had to borrow off that trust fund again to pay payroll, would you?
well,
Would you?
that's not right. We would not have had to, but that's the day-to-day thing. I mean, it's, cash on hand is a figure that's computed as of the end of a period of time, based on what our overall payables and obligations are as to what's in the bank.
Well, I want to ask you something. What is the problem with the cash flow that you all don't even have enough money to make payroll out there? That's what I can't understand. And I'm not trying to be disrespectful in no way.
That's a good
I
question.
got to know these questions,
I know.
the answers to these questions, because I've got a lot of questions here, and it's probably going to take all day to answer them, all of them that I have. But I'm just saying, if you've got 13 days cash on hand compared to the previous month of 8 days cash on hand, you shouldn't have had to borrow, let's see, you borrowed 90,000, yeah, 90,000 on the 18th, when you came before us on the 17th, making us think that everything looked good and everything and feeling good about it, then had to borrow off that other money on the 18th. It just doesn't make me feel like we're very financially stable out there.
All right, let me talk to you about the timing of things. Payroll itself, when we have to fund it Tuesday or Wednesday, that itself represents about 8.5 days of cash on hand. So I can tell you today, the cash on hand is 8, and if tomorrow's payroll, it would be all used up. There's some other key vendors we have to keep. They're all key, don't get me wrong. They're all key and important. But there's some others, such as the ER doctors, that we have to keep current. So these things, I mean, one particular high invoice can eat up 2 or 3 days of cash on hand in a moment's time. So when I'm talking about days cash on hand, that's a ratio and a computed figure as of the end of a month. And that's what we have to go.
Let me ask another question, Mr. John, to help me kind of understand it. How many patients, on an average, I know you got it down here, but I want you to say it for the record. How many patients, overnight patients, do y'all have on the average?
I'd say 2 to 3.
Has it been any period of time where y'all didn't have any patients at all in the hospital?
There's been that, and there's been times we've had 6 to 8.
Is the providers trying to just patch the people up and send them home? Or are they trying to, make sure that all the people are taken care of and that their medical problems are being taken care of and seen about? Because I've had one instance here in the past couple of weeks that the person needed to stay in the hospital, and the doctor in the emergency room, it was not Dr. Conrad, by the way, would not let them stay. They sent them on home, and now they got sicker and had to go to another hospital.
Yeah, well,
So that's not a good thing. That's what I'm trying to tell you. We've got problems out there, Mr. John.
off the record, if you could tell us, not in a public setting, who it was, we would
I would never
investigate it
do that.
and get back to
I would never
you.
do that. That's against HIPAA. But my thing is, I don't see where y'all are saying, okay, we were told that come the middle of May, that we would see a big turnaround, and that money would be starting to come back in as reimbursement. Have we had any of that?
Well, like I was giving you the short-term cash update, that's beginning to happen.
But what I'm saying, have y'all reimbursed the trust fund any
Not
money?
yet, no, not yet.
So we were supposed to have seen a turnaround sometime in the middle of May, right? Is that what you told us, Mr. Cooper? That's why I wanted you to stay here.
Yes, Commissioner, I expected the middle of May. I expected 4 months after the new computer system went online, which was January 19th. I expected 4 months, and then we would be at a position where we were back to our normal cash flow. I can tell you right now, we're generating about, I want to say it's about $335,000 monthly in cash. And when we're running pretty strong, it's running just short of 400,000. So yes, our cash flow is still less than what it was when we're going at a full rate of speed. But as John just mentioned, we're starting to see some of those big Medicare payments in the hopper. It's just they haven't come through yet.
Mr. John, I see that liabilities is 1.656 million, and it's up. Is this up,
Yes,
the
ma'am.
liabilities?
Yes.
Why is it up that much?
Well, that's a function of the collections, the revenue, the bottom line. To get back to finish and answering one of your earlier questions, we've been through, I don't want it to sound like an excuse, but we've been through, in 2 years, 8 different systems. And like I said, when I showed you, or talked about the Medicare money coming in the next day or two in Medicaid, I'm saying that there's indications that the billing problems that are inherent with changing systems, they're getting worked through, and the glitches, the bottlenecks are getting worked through and getting eliminated. That's an ongoing process, but it's happening. The other thing, like I said at the very beginning, if you look at the first sheet, the hospital and the clinics, it's a revenue problem too. That is gross charges, visits, activity, in other words. So those are the problems also. But again, like I say, and you answer your question about days cash on hand, I hope that was clear, because if payroll runs 160,000, say, there's 8 days right there. And so it's a timing issue also. You could ask me today, or the day before payroll, I could say we've had 13 or 14 days cash on hand. You could ask me the day after, it'd be 0 perhaps.
Okay. And another question from Mr. Cooper, and then I'm gonna end up my comments, Mr. Commissioner Massey, whatever. But Mr. Cooper, back in December, this board approved you $920,000 out of the healthcare trust fund to help y'all along, because you've seen the turnaround and come in about April or May, something like that. Now we're at June, and out of that $920,000, you only have $105,000 left in there to access for payroll or whatever. How do you expect, or what is your plan of action, which you need a plan of action? What is your plan of action that once this $105,000 is gone, what do you intend to take care of? Because apparently you're not refunding the trust fund any money or any of that. So what are you gonna do about payroll after this $105,000 is gone?
Well, I'm very hopeful that we won't even have to get that 105. I mean, we've already got the next payroll covered with the money that John was just talking about. So I can't answer that question because, you know, I've not got to that bridge yet.
Is that money made it?
Huh?
Is the money made it? The money y'all got, has it come in?
We will have payroll covered for next week's payroll. It will be covered by tomorrow with the money that's coming in. We can see what's going to get shipped to us tomorrow, but we can't, and there are times we can see checks that are in process, but we can't tell when they're going to release them. But once they release them, it'll show up on our screen, and we'll know a day ahead of time that it's going to hit our account. So we can say we'll have payroll covered tomorrow.
Well, let me just, Mr. Chairman, if you
Yes,
don't mind,
ma'am.
let me just make one more final thing. On May 17th, y'all stood up here and I was quite happy. Y'all were painting a brighter picture for the hospital in my way of looking at it. But then you turn around on May 18th and borrow the money. Now, y'all could have very well said May 17th, standing in front of this board. Now, I'm going to tell you a little bit about how I feel. I feel like, in a way, this board was disrespected. And I'm going to tell you the reason why, because we specifically asked questions. I did. And I feel like I was not told the honest truth. Now, I'm going to tell you how I feel. I feel like you need to give you all, whoever you all want to be, you all need to give more honest and truthful answers When we ask you questions, we're not trying to mind your business. We don't micromanage. That is your department to run that hospital. But it is our job to oversee the monies. And that's what we're looking at. So a lot of honesty and truth on my count, a lot of honesty and truth will go a long way. When I feel like you have not been truthful with me, therefore not the people, then I tend to lose my respect for people.
Commissioners, first of all, I do apologize for what happened at the last meeting and the day after. That was not intentional, and I can tell you what happened. We had talked about cash earlier, probably 2 or 3 weeks before that payroll, and had foreseen that it was going to be close. At the same time, I had also told John not to come and take any draws until he and I had talked, and we had agreed exactly what number we needed to draw on. It just so happened, and I know this is not going to sound honest, but it's the honest to God's truth. John was on vacation for 4 days, and I was gone the next day. The very first time that he and I had spoke in 2 weeks was when we walked in here that morning. We had no idea that we were going to take money the next day. I had no idea.
Well, Mr. Cooper, the way I see it though, y'all could have stood up here, and it may be a little thing, but it's not a little thing with me because I feel like I'm trying to ask the questions to get the answers out, and everybody just think Cheryl don't matter, Cheryl don't care. I do care, and that's why I'm asking you the questions. But what you could do in your speech to us or in your report to us is say, Commissioners, we may have to borrow some more money on that $920,000 that we got from you. I just want you aware of it. When I'm told the next day that you all had to get another $90,000 out of this to pay payroll, and then since then another $48,000 to pay payroll, it makes me feel like somebody's not being honest with not just me, but this whole board. And I have problems with that. Because one thing that I try to do to people is I try to respect them, but at the same time, don't respect us. I mean, we're very educated people up here. We've been in the system for a long, long time, and I'm gonna tell you something. You don't want to never burn your bridges because you don't never know when you may have to cross them again.
Commissioner, again, I do apologize. It was not intentional to do that, but I will make kind of a blanket statement here. And it goes back to your initial question as well. And I've mentioned this to you several times in the past. This business that we're in, that you're in rural healthcare, is very precarious. I'm not going to sit here and tell you today that tomorrow we won't have to come and get money. It's impossible for me to tell you that. It's so volatile that I can sit here today, and there have been nights I've gone home thinking very highly about the things that are going on, and walk in the next morning to, oh my gosh, we got no money again. And that's how quickly it can change. And so when you say I could come in and say we might have to take money, just think of that as every time I walk up here, we might have to come.
No, I want you to say it. I want you to say it, Mr. Cooper.
I'm saying it.
I want you to say it. When I ask you a point blank question, just like I asked Mr. John, and I gave him the praises, and what did I tell you, Mr. John? I said, I trust you, Mr. John. Is that not what I said to you, Mr. John? I trust you, Mr. John.
Well, I can't say anymore. I mean, it was not intentional to do it that way. It just was a timing issue. I do apologize. And and to answer your first question, Commissioner, we're doing the best we can to get this thing turned around, and I think we've made some strides, but I can't tell you that it won't be a bad report next month. I can't do that. So.
But what happened to the turnaround that you were supposed to see in May, though? I really want to know.
Well, you know, I've been through several of these conversions over the course of my career, and generally what I've seen is that the cuts are very deep but it's for a very short amount of time, for, let's say, 4 months, what I was projecting. What we've seen here is the cut hasn't been quite as deep, but it's gone on for a lot longer than what I thought it would. And so, I think we're starting to see the billing get back to where it needs to be. Just, you know, we started with, well, we had John, help me with the figures if I'm wrong. We had a $200,000 delay on outpatient lab charges. So that means we've got no charges going out. We had another $180,000, I think it was, of swing bed charges that didn't go out because of glitches in the system. All of those things have been fixed. Now, we think we're getting back on track. Early part of May, they add a different module to our system, basically shuts down billing for 2 weeks, which is a big part of what you saw when we had to go back and get more money for payroll. If we're not billing, then there's no money coming in. So, as of today, I can say there's no glitches in the system that I'm aware of. But that's not to say that that won't change tomorrow. But I think we're on the right track. And I know we've got a better system than we had a year ago. It's just a matter of the entire implementation for this program will take us into the early part of next year. They'll be adding different modules all the way through to next year. So every time that happens, something can happen with billing.
Well, we gotta get something straight, because the trust fund is not to run the hospital on.
I agree.
We cannot dip no more into that. We got $105,000 left. Then we'd have to start into another borrowing trust fund.
Commissioner, it would be my preference that we didn't use any money out of the trust fund or any subsidies. Unfortunately, the way that our government has led us, we're always going to need subsidies because the reimbursement, we're now at 38, 50, about 60 to 65% of our business is paid through some governmental agency. And the governmental agencies don't cover cost. Not charges, they don't cover cost. If it cost us $1 for a syringe, they'll give us anywhere from 40 cents to 95 cents, but it won't be cost. So something's got to make up that difference. When 75% of your business, 65% of your business is not covering cost, and then there's another 10, 15% that don't pay anything. So
I know you're trying, you're doing the best you can, but, it's just, we just gotta get it floating.
I agree.
'Cause there's a lots of money besides this that's been gone.
That's what concerns me about building a new hospital. We've got to get more on a better financial track than we are if we expect to build a new hospital. And that's what I'm saying. If we're taking patients and not admitting them, and then they're going home still sick, and then having to go to another hospital, then we're losing out on, first of all, taking care of our people. And, we just need to look at it. But in the future, if y'all have to get any of this money, notify the commissioners and let us know. Because, I don't want y'all to stand up here one day and then I'm having to borrow it that afternoon or the next day. Just let us know, and you got $105,000 left, and you need to be getting up some kind of a plan how you're gonna do. So anyway, thank you, Mr. Cooper and Mr.
Thank you, Mr.
John.
Make a closing statement about the positivity that we talked about in May. A big chunk of that was meaningful use money, roughly $400,000 or so that's coming. And that's been delayed by necessary concern and care on our part, but because we wanted to make sure everything was above board and legal. We had to manipulate, tweak the contract a little bit to make sure that they wouldn't just give it to us and take it back, because there was some due diligence we had to do in that, so that's postponed that a little bit. Thanks.
Mr. Chairman?
Yes, sir.
You know, I've been watching this thing ever since the beginning. And the day we saying this right, this wrong, it get to a point where everything get caught up at one time. And this system started out with, I guess, what, 10 years ago or better? And it's up to now. Now, we had 3 or 4 different CEOs in there. Each one of them, you got to go back to basic on. And every time one come, they had a new system they want to put in about the billing. This here, we gonna get a new billing system. I guess we at the point where it done just caught up with us. But for it's not the money. We get enough money to take care of the hospital. And I seen how it was going from the beginning. And this my first time seeing it, where we got to use what we use. Before this didn't happen. It's happening now. I don't know why. Something ain't right. It needs to be straightened out. Before the money being brought in with sales tax, for the money supposed to be collected with patients, it's there. I know the number. It's enough to bill a hospital and should be moved. I mean, you talking about $400,000 payment, collecting $1,800,000 on the sales tax. That's more money that's way more money than supposed to be billing a hospital, and you're supposed to be out there, should be taking care of itself. But we got to get on track. I don't know how long it's gonna take, but it need to get on track fast. Get it right. Get it back like the way it's supposed to be. That's all I can say.